COVID-19 has unleashed chaos in New York State. It's a place that offers perspective and lessons for us here in Canada. Dr. Robin Varghese is a Canadian in New York who normally works as a top cardiovascular surgeon, but right now he is all in trying to get control over COVID-19. Dr. Varghese, welcome and thanks for coming home virtually for this town hall.
Thanks, Heather. I'm glad to be here.
You're just coming off shift to the ICU at Mount Sinai Hospital, your hospital. How has it been tonight?
We're at a different stage of the disease process now, Heather, where we've peaked, it seems like, and we're now recovering patients. And so we're seeing the light at the end of the tunnel, and we're seeing patients improve. Much different than 3 weeks ago when we were in the surge phase, and we were just opening up intensive care units and filling them up within hours. Here at Mount Sinai, at the main campus, we have about 120 intensive care units for the various specialties. For example, in cardiovascular surgery, we have about 26 ICU beds. We filled up those beds pretty quickly, and we opened up additional surge units, and within hours we'd fill them up. Patients would require intensive care, and these patients require a lot more care than the standard patient, and so we've had to repurpose a lot of staff to help us out. After that surge phase, then we got into this phase where the patients seemed like they were not getting better, and we couldn't see the light at the end of the tunnel. But now we're seeing that once intubated, it really takes 10 days to 2 weeks before we start seeing the improvement. And that's where we are now. And we're getting the breathing tubes out. Patients are being liberated from the ventilator, and they're waking up, and we're seeing them smile, and we can give them the thumbs up that they're heading in the right direction and they're going to be seeing their loved ones soon.
For you, who's been in the midst of this, as you said, the surge, the war zone conditions that we have seen in New York hospitals, what is it like to finally be emerging from all of that, to be able to offer that optimism to those COVID-19 patients?
It's very encouraging to us as staff members, because during this period when the patients were intubated on the ventilator, they're heavily sedated, and so we don't get to know them as a person aside from what their family members tell us. And now we're starting to see them wake up, and we can hear their stories. And a lot of these patients are patients whose hands we've held just prior to putting the breathing tube in, not knowing what the results were going to be, not knowing what the outcome was going to be, just telling them that we're going to do our best and get them through it. And now we're seeing some of these patients come through it. A couple weeks ago, we intubated 2 cousins, 6 beds apart in the cardiovascular surgery ICU, both of them very sick. And now 2 weeks later, one day after the other, their breathing tubes came out, and both are leaving the intensive care unit. So great stories.